Sunday the 24th of October. Nothing too heavy today for a Sunday, but there is some really interesting and in fact quite relevant information on vaccine efficacy waning against infection. But we'll look at that in a minute. We're going to start off with a report from Chip McDonald. So thank you, Chip. Over to you. Thank you very much for this report.
So yesterday, the CDC agreed to allow me as a J&J recipient to get a Moderna booster. So this morning immediately I got up and proceeded to do so at Walmart, and upon arriving I asked the clerk, do you have someone that can do needle aspiration? She looked a little bit perplexed by that, which should have been a warning to me, but I proceeded anyhow. Long story short, I was sat down in the booth to get the shot. I confirmed with the nurse that was going to give me the shot that it was going to be a Moderna 100 microgram booster dose. I say booster dose, 100 microgram Moderna dose, and that she was going to aspirate. And she told me that yes, she would do that, and she proceeded to stick the needle in my arm and inject the vaccine without aspirating. So I'm looking at the syringe and I'm thinking it's too late, I can't stop her now. But then, to my surprise and disbelief, she pulls back on the plunger after she's injected me. So I asked her, why didn't you aspirate? Which didn't really make sense to her, I suppose, because in her mind she did actually aspirate. And of course she told me, well, I did. I said, well, you were supposed to before you injected me, not after. And then she kind of sat there and didn't really say anything. And I asked her if she had been trained to give injections, and she said she had been trained to do so and that they don't do aspiration anymore. And I said, well, do you understand why I asked you to aspirate the needle? And she didn't really say anything. And then I explained to her that I didn't want the vaccine in my blood circulating freely, possibly to my heart. And she told me that, well, she's given thousands of injections and she's never given an injection into a blood vessel. So I asked her, how would she know since she doesn't aspirate? Which didn't get a reply. So when she pulled back on the plunger, there was a little bit of fluid in the plunger, no blood in the plunger, in the syringe, but no blood. I presume it was vaccine, maybe 2% of the total amount that was originally in the syringe. So on the positive side, I guess I can surmise that I didn't get Moderna vaccine injected into a blood vessel. But as a word of advice to the listeners of this, possibly you may want to ask for clarification that the person that's injecting you understands that they are to aspirate the needle before they inject you in order to see if pulling back brings back blood, because if you do that in the reverse order, it kind of is pointless and redundant. So that's life in the 21st century. Thanks.
Thanks very much for that, Chip. Really appreciate that account. Now, I could give a sort of reasoned scientific pathophysiological medical response to that, but I think if I go that will probably suffice for now. Now, this is the main study we wanted to look at today on waning efficacy of the vaccines against infection. Now, we see straight away that this is a preprint, but it's got such important information in it, I decided to look at it in more detail. So I've read it, the paper looks pretty good. And then when we looked at the authors, we do see that this is Public Health Institute, Oakland, California, School of Public Health, University of Texas, University of California, and the Veterans Affairs Medical Center, San Francisco. So pretty good sort of credentials, really, for the people that are writing this. So no doubt in my mind that this is going to be accepted as a peer-reviewed publication pretty soon. So very happy to report on it as a preprint, as what it is. So, breakthrough SARS coronavirus 2 infection in 620,000 US veterans. So this is a pretty big number. This is a very good sample size. National data on COVID-19 vaccine breakthrough infection is inadequate, the Veterans Affairs Association say, and they're right. Comparing SARS coronavirus 2 by infection and vaccine status. So they took people that did have a PCR positive test, compared that with a vaccine status, and looked to see how many got symptomatic disease. Now, it's important to point out that this paper is not about severe disease, hospitalizations and deaths. It's about the presentation of symptomatic disease or a positive PCR test. So that is an important limitation. This paper only tells us what this paper tells us. But there is a pretty startling conclusion. So February the 1st, 2021 to the 13th of August 2021, Veterans Health Administration amazingly covers 2.7% of the whole US population having military experience. Vaccine protection declined by August 2021, declining from 91.9% in March down to an average of 53.9% in August. So this is looking at it from March to August data, so 91.9% in March, down to 53.9%. And the probability of that arising by chance was only 1 in 100, so that's what we call a highly significant result. And that was, as we say, basically 620,000 veterans. Now, declines were greatest for the Janssen Johnson & Johnson vaccine, followed roughly equally by the Pfizer, BioNTech and Moderna. And this is where the figures are actually quite surprising, really. So specifically, according to this paper, here we have specifically protection against infection. Janssen Johnson & Johnson, March it was 92%, August it was 3%. I mean, that is what it says. I've double checked that about 10 times. 3% protection against infection. Absolutely staggering drop off in protection. Moderna, 91% in March, 64% in August. And Pfizer, March 95% protection and August 50% protection. So pretty massive reduction there we do see, particularly in the Janssen Johnson & Johnson vaccine. Now, this will be caused partly by waning of vaccine efficacy, that we know that happens, but it's also caused by the switch from the Alpha variant to the Delta variant, and we know that there can be some issues with the Delta variant with a modest amount of immune escape. So it's a combination of those two factors. And of course, the authors are very well aware of this. So Delta variant is the primary determinant of infection in the August sample. So, and as time went on, more and more Delta variant, of course. Now, the authors say this: it's not yet clear whether reductions in vaccine protection against infection will translate into similar reductions in protections against hospitalizations and death. Now, it looks like it won't, but they say that basically this is good science. They're saying we can only say what our data says, and this is what it says, so they can't comment on that directly. We do know from other evidence that vaccines probably carry on protection against hospitalizations and death for much longer. But that's just what this paper says. Vaccines remain the most important tool to prevent infection, severe illness and death, they reinforce. But vaccines should be accompanied by additional measures, including, and they specify, masking, hand washing, physical distancing and other public health interventions. So they're saying that this layered approach would be beneficial. But there we go. I mean, that takes nothing away from that figure there, which is quite startling. Now, this is why, of course, people who've had as indeed Chip. People who had the Janssen Johnson & Johnson vaccine are being offered booster doses within 2 months of their last vaccine dose. Now, there's quite a lot of evidence to say that if you've had one Janssen Johnson & Johnson, you have another, that probably gives you good immunity. But the CDC are going to decide or sort of give guidelines on how these vaccines are mixed and matched next week. And it looks like they are going to say a Pfizer or Moderna for someone who had first dose of Janssen Johnson & Johnson. So that was quite interesting. Now, on this channel, I must say I'm completely spoiled with feedback, emails and comments from you. So I just want to give you a couple of these to illustrate that Chip's difficulty, shall we say, is not unique. And I haven't picked these to try and illustrate my point at all. They are genuinely what emerges from what amounts to data that you send me. So this one's from CL. Got my first shot 2 days ago. I requested aspiration. I was told IHS did not recommend aspiration and they have to follow protocol. The head nurse came over and accused me of telling staff how to do their job. I simply requested aspiration and expressed my concerns. She went on to tell me that aspiration can increase chances of an embolism, while also telling there's no chance of hitting a blood vessel. I was told to take it without aspiration or don't receive the shot, British Columbia, Canada. This, of course, is a complete disgrace to healthcare. There used to be a concept in healthcare called compliance, and that meant that you have to get the patient to comply with what you say. So if I say take 2 a day, you take 2 a day. You better comply. That's kind of the old-fashioned idea. Now we talk about concordance. And concordance is where we come to agreement with the patient. Look, don't you think it would be a good idea? I think it would be a good idea if you took these 2 pills a day. Can you see the advantage in taking 2 pills a day? And we come to agreement. And the patient walks out of the consultation in complete harmony with the healthcare provider. Let's just say concordance was not reached in the case of CL. Increases the chances of an embolism? Well, it's news to me. I've been given intramuscular injections for over 40 years now, and it's news to me. Nor do I know of any evidence for that. So the most generous thing you could put there is a question mark. If I was marking an essay, I'd put a cross there. So Canadian authorities, let me see, 0 out of 10 there for that particular assessment. Another one. I had my second Pfizer shot yesterday in Melbourne, Australia. I asked the nurse if they would aspirate. They said they didn't, and there was a low risk of hitting a vein. I agree, there is a low risk of hitting a vein, but there's not no risk of hitting a vein. Where they put the needle in. They said a whole load of things, something about deltoid, or some word like that, and where the muscle was, and it was a low risk of hitting a vein. Yes, it is a low risk, but it's not no risk. So again, let's say concordance wasn't reached, and I think I'll give that particular centre in Melbourne, let me think, I'll give them a 0 out of 10 as well. So that's what I would give them if I was assessing their work. There you go. Now I'm going to finish off with the this one's pretty good actually. It's a bit of it's kind of a joke, but it's kind of not as well. It just shows how you bring people along with you. It's really quite clever. So I found this this was in Medscape. COVID vaccine rates vary by people's zodiac sign. Okay, let's go on. Now this is taken from data published in the Salt Lake Tribune. I must say it's a publication I wasn't overly familiar with before that, but nevertheless, there it is. But it is based on data from Salt Lake County Health Department, so that is good. So in response to this article, the Salt Lake County Health Department, rather than get all sort of hoity-toity about it, they kind of went along with it, which I thought was really clever. So they said this: the COVID vaccine is backed by science and is no way influenced by horoscopes. But then they said, but come on, Scorpios. Is it Scorpios? Okay, so I thought that was quite funny. It was quite funny. So they obviously said it's gobbledygook, which of course it is, but then they sort of made a bit of a joke out of it. Then they tweeted, again, Salt Lake Health Department, now that Mercury is not in retrograde, we're just going to leave this here. And yes, this is based on data. So Mercury's in retrograde, so we don't need to worry too much about vaccines and star signs. So like the Salt Lake Health Department, we're going to leave that here. And we'll leave this video here as well. And thank you for watching.